Welcome back to Laugh Through It All. I'm your host, Tracy. Come join me as I talk to Dr. Varghese about menopause. All right, so let's just get right into it and tell me what exactly is menopause.
Menopause, by definition, is a transition from, the fertile portion of your reproductive health to the infertile portion of your reproductive health. Essentially, the ovaries kind of shut down at that time. They were awakened during puberty and they've been keeping you going this whole time. And now there's not much left for them to do. Any eggs that are remaining aren't going to really be super helpful. And bearing a child is just not physically probably ideal for women at this stage. So it is the decline and decrease of estrogen and the transition to an infertile period. Perimenopause is kind of the buildup before, and it can be months, years, and in some circumstances, for some people, decades.
Decades.
There are some women I have come across that start feeling hot flashes and night sweats in their 30s. So average age of menopause worldwide is 51.
Okay, you said for menopause is 51.
Right. So perimenopause, meaning the symptoms and the
Yes.
situation leading up to that portion, right? So classic symptoms, of course, are the hot flashes and the night sweats. And I do have women in their 30s that are already starting to see that type of feeling. I mean, chemically, everything is going to look the same, but there are a lot of women who really just start to feel that they are not themselves, and things are starting to change in their 30s and 40s, which is a good decade before average menopause.
Well, that is just certainly not fair that we have to deal with it sometimes a whole decade ahead of time.
I mean, if you look at the amount of physical and thereby the emotional and in all the ways that it leads to, women are dealt a slight hand. And I think that for me ends up being primarily because it's overlooked and undervalued and underrated.
Sure.
So for so long, women were not included in any studies because they were trying to minimize variables, and women come with variables, time of the month and, menopausal versus non-menopausal, hysterectomy versus not hysterectomy. So for a long, long time, women were not even included in any studies. It was all men. And then there was some large women's health initiative, I believe, in the 80s. And that's when they started, 80s and 90s, we were doing a lot of hormone replacement. So there's a little bit of empathy for it. And then this women's health, then there were some studies that showed that there was an increased risk of cancers. And then it all really, in my training, became like, no, we can't use these. And we're now starting to see in the last few years that we underestimated the amount of damage, trauma, and difficulty women have in this transition, and probably a little bit overemphasized the mild risk for most of increased risk of certain cancers. And so now you see a 180 where there's just a lot more allowance for recognizing women's symptoms and treating them.
Everyone's symptoms are different, of course, but what other symptoms besides, night sweats or just sweating in general? Because is the sweating in general, is it just like a normal sweat? Or because recently, I'm not gonna lie, like I felt like it's not all the time, but it's like a heat that comes from within. Like you feel your whole body is hot. It's
Mhm.
not so much just the sweating, it's the heat that comes from inside. It feels like it's
Well,
inside.
right, because the sweating is an opportunity to cool down. So
Yes.
it's that feeling hot first. And I have in my office, in my personal life, amongst you will be talking to someone like you and I are talking, and they start to kind of feel a little bit this, and you see them kind of doing this, and then you turn around and they are dripping, like somebody dumped a bucket of water on them. And 10 minutes later, they're shivering because it's all drying up.
So is it usually that quick? It comes and goes, but it's that
And
quick?
it runs the gamut. Most people, many people have kind of more subtleties to it. Some women have no hot flashes or night sweats at all. It runs the entire trajectory of nothing to complete interference with quality of life because of sleep impairment, because of, having to get up and change your sheets, having
Yes.
to get up and shower. You need the room this temperature, your husband needs or your partner needs a room this temperature, having a fan and then having to turn off the fan, being hot and then being cold, and this is where I feel like there's a little bit more importance put on that, because while it's not life-threatening, it certainly is a reduction in your quality of life.
For
And
sure.
that is, if you've never had it, or women aren't part of the conversation, you can't understand that. So look at a hot flash on paper versus to feel a hot flash, or to spend 5 years not sleeping well because you're waking up with these. You can't explain that to somebody. You really just have to perceive it.
Crankiness. I hear crankiness is one of them.
Again, brain fog, memory loss, just really not any element that is not you.
Right.
This sort of like alien invasion, I guess, seems to be what. And again, not every woman. There are many that are super excited to be done with their periods. It was a misery on a monthly basis. It detracted from the things they could do, how well they could function, bleeding and cramping and you name it. So this is something they've been looking forward to for a long, long time. And other women really more in their previous selves.
Do you think that if you have heavy, hard periods that you're easier on the menopause, or it doesn't matter?
There is no prediction that I can see other than when people have genetics that they, I'm really like my mom, I'm really like my aunt. And, we were talking and she had the same situation. And so there's that camaraderie. That's the only predictability. Even that is,
I was gonna say, so genetics does or doesn't
of
play a
course,
part?
I think that that's the only constant I've seen is that whether it's the cycle itself.
Okay.
My mom had terrible periods. And so they're the ones that are often more likely to bring in their teenage daughters struggling because they remember what they went through. And it was exactly the same thing. So it's all anecdotal. I'm sure there is so much of every part of us is genetic, whether we realize it or not.
Right.
Um, but yeah, of everything that has held true in my experience, and again, no studies to hang my hat on, but certainly in doing this for a while, you do see the female camaraderie in the family, and that gives some kind of playbook.
My mom had hysterectomy in her early 40s, so that put her
And it's
in.
not just your mother's side,
Okay.
it's female relatives. So it could be on your dad's side, but an aunt or a grandma, right? It does, you are
Both.
conglomeration of a whole bunch of people.
Yes.
Yeah.
So for me, and it's funny because you don't know this, but I always joke with my friends about you because they'll say, "What did your doctor say about this?" And I'll say, "Well, she said it's probably perimenopause." And I'm like, "Everything can't be perimenopause."
But it's hard to not, because you see a very specific amount of women in a very specific age coming down with these very specific symptoms.
Because my period has been last month, I had it for 27 days. So lightly. And there someone's like, because I had it before where it would, it lasted like 21 days. Now, not heavy, spotting for the most part, but still consistently every day. And
Yeah.
and then of course, well, that was 2 months ago. So then by the time I got done, didn't have it last month. So now we're gonna see if I get it this month. But
Yeah.
but that's what someone said. They're like, "Oh my God, why are you still on your period?" They're like, "Have you asked your doctor?" I'm like, "Well, the last time it happened, I said it to her and she said, well, probably perimenopause."
Because your estrogen levels are dropping. So what happens is when you're in a regular menstruating cycle, the estrogen is at a level that keeps the lining established and stuck to your wall. And as your estrogen levels drop, you produce less lining, but also it's not sticking. So it's unfortunately, I mean, I'm not trying to kind of like, it's not a garbage pail in the sense of being poo-pooing it or
Sure.
underestimating it, but there is a lot of hormonal transition that women are going through, and I put nothing above it.
Yeah.
That's sort of my thing, because it is consistently women in their mid to upper 30s to mid 50s, and you hear my memory, and emotionally I'm not the same, and physically I don't feel the same, and I'm gaining weight, and I'm seeing this midsection, and I feel a little bit foggy. What else? You know what I mean? It's just there's no other thread. And again, society kind of underestimates the toll, but pregnancy isn't easy, periods aren't easy, puberty wasn't easy.
Well, that
Menopause comes with wonderful things, but it is relearning who you are, or sorry, maybe not relearning, but finding out who you are now.
if I'm 51, I'm gonna be 52 in March. I mean, shouldn't I be full blown by now? I mean, really?
So average age is 51, which means you will have women, you know, it's likely statistically very much that this year, because the actual full menopause is no period for 1 year. You're already seeing signs of it by these long periods because the estrogen levels are dropping, so nothing is stabilized. You can, you know, hormonally manage that if you like, but your ovaries are close and shop.
Done. Yeah.
So average age is 51, but many women are 49 and 50 and 53. And some, it is not the norm, but you will get some women 56 and 57 still having periods. Not the norm, but then again, neither is a woman who went through from menopause at 45, which happens as well.
Right. So you said a year, you have to be a year without a
The
period.
definition of
technically-
menopause is a year without period, but there's also blood testing that we can do that verifies it.
Okay.
But most women don't need it, right? So the clinical definition is no period for 12 months.
And what are things that you can do to relieve the symptoms? I know you said hormone therapy. Is that what you said? Hormone
Well,
therapy?
so yes, I mean, if you want, there's lifestyle changes and there's medication. Those are kind of the two ways that people primarily are adjusting or affecting or helping where they're at. The hormonal options run the gamut of hormone replacement, antidepressants, some blood pressure medications, again, depending on what your symptom is. So
Okay.
you have the brain fog or the mood, you know, lability and just not interacting with the people in their life the way they want to. They may choose a mood medication. Somebody who is really having struggles with some of the vasomotor, as we call them, so that's the night sweats and the hot flashes. The most effective course with that is hormone replacement for sure. But some women, due to their own medical history or their own sort of feelings about it, would prefer to steer clear of that. So there are some blood pressure medicines that we can assist with in regards to that. And what we do know is healthy living is healthy living. So reducing inflammation, reducing stress, making sure your exercise is there, making sure your nutrition is there, keeping, you know, that highly processed foods and the high sugar diet and all that to a minimum. All of that does help as well. Finding a more normal weight for some who struggle with their weight. And I do know that menopause makes that job even harder, and that's nobody's fault. It is all part of the chemical transition, which includes losing a lot of muscle mass that you had maximized around your late teens, early 20s, has been declining since, and then kind of falls off a cliff with menopause. Why strength training is so much a part of physical activity in menopause, where it may not have been previously. Maintaining your strength, maintaining the flexibility that can offset some of the emotional pieces. Some women really feel kind of like their body kind of let them down, or that they don't recognize what their body's doing, how their body's feeling. And so doing all of those positive things will assist in that as well. So just really, as is everything, you can't disconnect any one thing.
The hormone replacement, first of all, first question is how long do you typically have to stay on that though?
Again, it does not have it's not a stringent guideline. So initially, when we were very concerned about the heart disease risks and the risk of cancers, the heart disease risk has been somewhat neutralized. We've had some studies that show it increases, some studies show that decreases. So the biggest concern that most doctors had in prescribing the medication was the increase of breast cancer and uterine cancer specifically. And so there was, years ago when we were limiting the use, it was okay, if you're going to use them, you get 5 years. I don't think we're sticking with any true end, because I think we are seeing that it's not so concrete. You know, I remember early on in my career, she had been put on hormones when it was kind of the thing to do. So there was a time when everybody got on hormone replacement, whether they needed it or not. And I think that's also erring on the sign of overuse. But she got on them, and she was in her 80s, and it was a conversation like, do you think maybe we want to try this? And I think we started weaning her down, and she immediately started getting like night sweats and hot flashes, and she was not going any further. And it was not a conversation that was going to be productive. So we returned and left it at that. So it just depends. I think for many women, a lot of the symptoms are more transitional, but there are some that carry these issues long term. So again, it's not because, again, we're trying to garbage pail the situation or like, well, everything must be men, but it can be. And I think what I'm trying to communicate is that you're not wrong. You're not alone. You aren't crazy.
Right.
Your body is completely foreign to you up until this point. There's nothing wrong with it, but that doesn't mean we can't help you.
Tough time with birth control pills did terrible things to my mood. So I stopped doing that many, many, many years ago. And that just wasn't a form of something that I could do. Would I have the same? Is it possible? Is there a chance that I would have the same effect with the hormone, any hormone therapy that if that was the route I took?
Birth control pills are both a combination of progesterone and estrogen,
Okay.
as is hormone replacement, a combination, or menopausal hormone supplementation, or whatever it's being sort of termed these days. It is estrogen and progesterone.
Okay. So I probably had to have the same type of effect.
It's tough. It's tough to say because you don't have as much of your endogenous hormone to be produced. If it's something you wanted to investigate, there's the option of starting slow
Right.
and going from there. The estrogens that we're primarily using, especially for menopause, tend to be more patch related. So was
Oh,
there an issue with digestion? Those are questions that are unknown. So it really comes down to, do you want to bother to try? Probably be determined by how you continue to progress in your journey.
yeah. Let's just hope. Let's just hope I don't have too many more 27-day periods. Let's just hope.
I guarantee that will end. There is no question in my mind that that will end.
Yeah, that's what I'm like, you know what? If you need to just flush out, I'm gonna give you these 27 days. Go
If
ahead. Do your
Right. And I mean,
thing.
we can do something. I can absolutely cycle you even now on birth control, but obviously you just mentioned your mood. There are some do, but if this is not a hardship for you more than an annoyance,
Yeah, for sure that's all it is right now.
it is normal.
And of course, there's no saying how, like if I just had a 27-day one, I could still have another one this month, right?
Because again, that estrogen is not to the level
Yep, and it's
that
not
is
sticking, you said.
adhering to, yeah, the lining is not maintaining itself in the uterine wall.
Damn uterine wall.
It's the estrogen, which again, there's lots of things you don't have to worry about, won't have to think about, won't have, planning for, but where there's good, there's always going to be a negative.
So, as far as menopause, how do you think it affects mental health? Because now, just from my experience too, because I like to put it out there, I have suffered with depression. I am on medication. I do take Trintellix. So, do you think how do you think menopause and mental health?
I think they're directly connected. Again, it depends on all of these things and how they're affecting you. If you're not sleeping, well, we know that that's a direct connection.
For sure.
But there is very well understood that a lot of women see a brain fog, almost a sense of a cognitive decline or a slowing of their faculties. Do we know why? I do not know why. Is it all built into estrogen? Maybe, maybe not. I can't answer that because I don't think every teenage girl that goes through puberty suddenly sees their grades like go crazy.
All right.
But you have lived in this chemical balance for this long, and now something has adjusted. So that is a very recognized associated symptom of menopause. And I think that is one that some women who choose to go on hormone replacement have seen some improvement with. I do
Oh,
think a lot of women who do antidepressants during menopause as well. And obviously that can be helpful if people sleep better. That makes
mm-hmm.
a
For
difference,
sure.
right? So it's not clear cut, but it's very common.
But then I also thought, well, maybe, gosh, once I go through menopause, maybe if hormones in general affect me that way, that maybe I'll get, maybe my depression would be better, or maybe I wouldn't need
And it's
medication,
not to
or
say they
maybe,
wouldn't, because again, just pregnancy for some women was like they didn't need anything.
yes,
Postpartum was often horrible, or it varied.
yes.
The thing
I
with
did have
menopause,
postpartum too with
right,
after my son.
right. So that's another influx or a big
Yes,
transition of hormones. And not every woman goes through that, right?
right.
So
For
again,
sure.
but menopause is now permanent. right? You will no longer be fertile. You will no longer be producing that hormone to the degree you were. So you are now menopausal. Like, well, when I'm through menopause, it all goes away. May not.
Maybe not, but there is hope.
There is hope. Again, most people, I think, see the transitional time as being the most difficult. And again, my point is just that I'm not trying to be negative. It's just be aware so
Sure.
that we can be on top of how you feel. And we acknowledge that there is no set written formula for this or recipe. Your journey is your journey. So let's see what happens.
What do you think are some myths about menopause?
That it ends.
That it ends.
Everybody goes through these things, because I'll have some women like, I'm not having any. And I said, well, you won't. Also,
You're
it's
always in it, but you may not have the
not the
symptoms
same
anymore,
journey. It's not the same journey.
right?
Some people don't have any night. I haven't had night sweat. Well, you may not be part of your journey. And again, like some people think it's just the best thing in the world. They are so happy here. They are so glad to be done. Everything was so difficult during their, reproductive years that they're just done. So I don't know that there's so much myth, and maybe there are. That's maybe for your viewers to tell me. I think what
Right.
my main focus is that is undervalued and it's underrepresented and it's underdiscussed. So many women just sort of quietly suffer. And I guess I don't want them to do that anymore. Women are definitely is a transition in this age range now, but 10 years ago and 20 years ago.
And you probably would agree that uh, more women nowadays do seek help from a doctor, where
Advocate for themselves.
I guarantee you my grandma for sure did not, absolutely did not.
Because of twofold. Number one, women didn't advocate for themselves in many
No.
ways. So it's all part of that culture. But also, I do think, and again, maybe I'm biased, but I have a lot of women that seek women physicians. It's a different conversation, I think, and I'm not discounting my male colleagues at all.
No, absolutely
Not
not.
at all. But with now more than 50% of the medical profession being women, I think that changes the landscape.
Because trying to talk to a man who's never experienced it, they can have all the professional opinion they want, but
And even empathy, but it's
yes,
still, there's like a level of it's speaking a different language in some cases. And again, not discounting my male
sure.
counterparts, male colleagues who specialize in women's health and, gynecology.
If I do this podcast for any other reason, then I want women to speak up for how they're feeling, and I'm a
Not
huge
suffer in
advocate for
silence.
people. Yes, for if and for me, even doing this is very therapeutic in anything that I deal with, So you talk to people and you know that you're not alone because everybody is suffering from something or dealing with something. And
Sometimes just the act of talking about it,
absolutely,
even if I say, this is menopause, but you're not crazy. This isn't in your head. You didn't make this up. This doesn't make you weird. Sometimes even just acknowledging that I can't change your hormonal balance.
right.
I can tell you that you are seen and heard.
Yes. Because now that I'm thinking about it, I was just telling my mom is I'm like losing words. Things
Mhm.
and you said brain fog. Is that would be considered brain fog? Where I'm like, God,
I mean,
know,
I guess
I
I
know this
don't,
is a pen,
maybe.
but I may not be able to come up with it.
Right. Yeah. So it is, I guess I've definitely heard that too.
Oh,
Mhm.
damn,
Mhm. I don't know if I'd
menopause.
lump it all together, but it's just this,
It's
you are
starting.
not functioning like yourself.
Yes. And then
Yeah.
you don't feel so educated. I'm thinking, gosh, I can't even string along a sentence.
Well, right. And so that's the other thing is it's not your fault. You
It's
aren't losing it and you aren't less capable. There are just different accommodations or process that you need to go through. It happens when you suffer in silence that you kind of quietly sort of maybe disengage or I shouldn't do that. That might be this and I don't want to do that. Like unfortunately many women have to do with their periods because they're so horrific worldwide, so they can't attend school or I mean it's just the accommodations that are not available, the
right.
understanding, the empathy, causes women again suffer in silence. So that's the only thing. That's the most important piece, because this is happening. This is happening to any woman beyond a
We're
certain
not.
point. It is going to happen. You will not be fertile for most of us, thank goodness, into our 60s, right? Um, but it doesn't have to be scary and lonely.
What advice would you give, or things to look for, or if you could say anything to men who are dealing with for their partners or or their moms or their sisters, what is any advice you could give to anybody to help them deal with it?
Well, I think probably what we should all be doing is just listen. When I said to you, that's menopause, it's not, again, trying to dump it in a bucket and saying, well, there we go. It is
Yep.
giving you the allowance for, this is happening to you. This is real. This is a part of your reproductive cycle. But how are, oh, I'm finding words. I can't find my words. You are not alone. We have an exact treatment for that, but we can investigate some classic menopausal options if you'd like. This may be temporary.
Is it a coincidence that the word pause and men are in a word are in a word that makes us so miserable?
Actually, I'd have to look that up because a lot of the medical stuff is Latin based, so I have to look at that. But I would not put it past
Yeah.
the medical community, given that hysteria and
Exactly.
hysterectomy have the same Latin root.
Oh, good one. God, look at you. Nice.
Yeah.
Yes, that's right too. They're going to get us, but we will survive. That's right. Well, I thank you so much for joining me. And I learned so much. Hopefully, the listeners learned so much. And I will leave your contact information. I mean, I can highly recommend you. I appreciate you coming along on this journey with me. I appreciate your time.
If there's two things I want people to know, women, this is women to know, is that they are not alone and they are not crazy. And there's nothing wrong with them.
Right.
We can
Right.
help, but there's nothing broken.
Thank you so much to Dr. Varghese for joining us today and giving us some great insight into menopause. If you would like to make an appointment with her, you can reach her at 586-726-4823, and she works out of the Silver Pines office. As always, do better, expect better, and be better. And no matter what you're going through, laugh through it all. Come back next week and join us.